Bioperfectus COVID-19 Antigen self-test plays an important role in the early diagnosis of COVID-19 infection for individual. If you have had recent exposure to potentially infected people, along with any symptoms consistent with COVID-19, you should seek medical advice and take a COVID-19 test to stop the further spread of the virus. How to perform Bioperfectus COVID-19 self-test at home. There are some precautions you need to notice before you start to perform the test. 1. To obtain correct results, read the instructions carefully before starting the procedure. 2. All test pieces are single-use items. Do not reuse the used test devices, tubes, or swabs. 3. Check the expiration date carefully. Do not use the kit if it is expired. 6 steps to perform the test. 1. Preparation before the test. Wash your hands thoroughly with soap and warm water, or use hand sanitizers. Bioperfectus SARS-CoV-2 Antigen Rapid Self-Test Kit includes 6 items. They are operation sketch card, cassette prepacked extraction tube, swab, instruction for use and biohazard bag. Make sure all the components are provided, and nothing is missed after you open the box. 2. Set up the prepacked extraction tube. Take the prepacked tube out. Keep the prepacked extraction tube head upwards, and shake the tube 2 to 3 times. Unscrew the purple cap from the prepacked tube. Place the tube in the preset hole on the package. Three. Collecting the sample. Remove the swab from the packet. Make sure you do not touch the soft part of the swab. You can use a mirror to help you do this correctly. Slowly insert the entire swab head into one nostril until you meet resistance. Usually it is half to 3/4 of an inch depth, depending on the size of the person's nose. Repeat the steps in another nostril. Rotate the swab at least 4 turns for at least 15 seconds around the inside walls of your nostril. Remove the swab gently after finishing the collection. 4. Process of the swab sample. Take the prepacked extraction tube out from the preset hole. Place the swab into the tube. Insert the swab fabric into the tube, and squeeze the tip of the swab through the tube for 10 times while rolling it around the tube. It is important to mix thoroughly. Remember to break the swab, and leave the head of the swab in the tube to allow the full absorption of the sample. Screw the purple cap on the tube tightly to avoid any leaks. 5. Perform the test. Remove the cassette from the foil pouch. Place it horizontally on the table. Unscrew the white lid on the top of the prepacked extraction tube. Gently squeeze the tube to dispense 2 to 3 drops of the liquid onto the sample well of the cassette. Set the time for 15 minutes after the liquid is added. 6. Read the results. If 2 lines appear at the T and C area, sometimes the line at T area can be very faint. Any line visible indicates a positive result. A positive test result indicates that antigens from SARS-CoV-2 were detected, and the patient is very likely to be infected with the virus. If there is only 1 line appears at C area indicates a negative result. If there is no line appears at the C area, which indicates the test is invalid or some reason. Test should be performed again with a new pre-filled tube and test strip. After finishing all the steps of the test, place the test pieces in the biohazard bag, and dispose all test materials in trash. With regular self-testing, we can slow the spread of COVID-19 and help protect ourselves, our families, our friends, and our communities.